recording going? I just love that. I don't know. It just sounds so official. Okay, here we go. Okay, guys, we have so much material to cover today. So I'm going to try to be as succinct as possible, but still making sure that you get all of the valuable info that I want you to have. So there are going to be parts where I kind of skip forward a little bit. You are getting the free ebooks, okay? You are getting an ebook on low testosterone. You are also getting an ebook on menopause. For those of you who are app subscribers, you're getting even another ebook. So check that out very shortly. So I'm going to go quickly here, but like I said, it's a lot of ground to cover. All right. So everyone, welcome. You guys, most of you probably know me from social media as Pharmacist Jamie. I have been a pharmacist for over a decade now. My passion is helping people live their healthiest lives. And this is my favorite part of the whole gig, is just teaching these in-depth classes where I can do so much more information than I can in those tiny little 1-minute reels. All right. I teach a free class every single month that is available to everyone. We've already talked about weight loss, heart health, diarrhea, and constipation. I also teach a class that is for my app subscribers only. Guys, the app's only $6. It's literally a steal. And as I said, you're also going to get another free ebook today if you're an app subscriber that's not available to everyone else. This month, the app subscriber only class is all about prostate concerns and PCOS. So should be interesting if that is a concern of yours. That's not a concern for everyone, but if you are at all, well, I think all men should tune into the prostate class because it happens to all men as you age, period, end of story. PCOS is a little bit more specific, is not going to apply to everyone. Stick around for a free gift. You guys are going to get the ebooks I already talked about. We already covered that. All right, so what are we going to cover in today's class? We are going to cover the signs and symptoms of menopause and low testosterone. A lot of people don't even know if they're going through perimenopause or menopause, or they have no idea if they've got low testosterone. They just know that they feel old, tired, and crummy, right? So let's learn about exactly what these things mean and how you know that this is what's going on with you. We're going to talk about why menopause and low testosterone happens. We're going to talk about natural methods to help balance out these hormones and help you during this time, including supplements as well. And of course, pharmaceutical options. This would not be a class taught by a pharmacist if we didn't go over the drugs. All right. Okay, quick disclaimer. This is not a prescription for any of you. I don't know any, well, I know some of your health history because I'm working one-on-one with some of you, but for most of you, I don't know your health history. I don't have access to your medical records. Talk over everything we discuss here with your healthcare provider, okay? Because not everything is for everyone. So don't take this as gospel. This is just to keep you informed so that you can make better healthcare decisions and have better conversations with your provider. Okay, we're going to go backwards. I know everyone always says ladies first, but I wanted to dive into testosterone first. It's just a little bit less complicated hormone-wise because men only have to worry really about the one hormone. Women, we have to worry about so much more. So we're going to address testosterone first. We're going to kind of jump back and forth, but we're going to open up with signs of low testosterone. Now, unfortunately, testosterone is not routinely screened or tested. We just don't really monitor those levels, even though it's fairly common. About 25% of men over the age of 30 and 40% of men over the age of 45 and 60% of men over the age of 65 have low testosterone. So I know sometimes men will come to me in the pharmacy and be almost embarrassed or like, you know, why am I so weird? What's going on? It's incredibly common, you guys. It is so incredibly common. Okay. So if you've got signs and symptoms of low testosterone, do not feel bad about getting checked out. I mean, 25% of very young men have low testosterone. All right. Now, it is generally defined as less than 300 nanograms per deciliter of testosterone, but you'll see some definitions as low as 200. So there's a little bit of disagreement. In my opinion, these are nice guidelines, but really it's more about your symptoms. If you feel great, don't worry about it. If you feel crummy and your levels are at 300, then you might want to look into getting treatment for low testosterone. Okay, so we got to take the whole picture into account and not just, you know, test the numbers. All right, so some of the classic signs and symptoms of low testosterone include trouble focusing and concentrating, a bit of a brain fog, Losing muscle mass. This is probably the biggest key about if you are dealing with low testosterone. Are you having trouble putting on or keeping muscle mass suddenly, even though your routine is the same? Trouble sleeping or constantly tired. Testosterone is a very youthful hormone. It makes you feel great. It gives you energy. If you're low on it, you're going to have the opposite effect. You're going to feel super fatigued and tired, even though you shouldn't feel that way. Reduced physical ability and stamina. Once again, if you are keeping your routine exactly the same and you are suddenly having all kinds of difficulty with your physical stamina, low testosterone may be to blame. Lower libido or erectile dysfunction. Now, this is what everyone thinks of when they hear low testosterone, but it is not required, okay? Actually, most men who have low testosterone, they're doing perfectly fine in the bedroom, okay? Their libido is fine. They don't have erectile dysfunction, so they don't think that they have low testosterone, even though they have all these other symptoms, right? So do not think that, okay, just because everything's working down there, that it can't be low testosterone. It absolutely can. This is just one of many signs and symptoms, okay? So don't rule out low testosterone just because you don't have erectile dysfunction. I want to make that clear. All right, increased anxiety, irritability, and depression. As I said, testosterone is kind of a feel-good hormone. It makes you confident. It makes you feel on top of the world. It makes you feel young, right? So once again, if you're missing it, what's the opposite of confidence? Anxiety. What's the opposite of energy? Depression, right? So weight gain. We will see weight gain happen a lot with low testosterone. Sorry, guys, I got to keep letting people in from the waiting room. Especially because we'll talk about this a lot more with the ladies, but fat makes estrogen. If you have a lot of fat cells, it makes estrogen. So what can happen with men who have low testosterone is that it can kind of be a snowball effect where they have low testosterone, they start to gain weight, their fat cells crank out some more estrogen. So now they have even lower testosterone in relation to their estrogen. It's a big vicious circle, okay? Loss of armpit, pubic, or facial hair. I should have also put facial hair. So testosterone is what gives us really a lot of hair on our bodies. If you suddenly lose that, you're going to have a decreased amount of pubic, facial, and armpit hair. Okay, so why does low testosterone happen? Okay, so there is primary hypogonadism, which is underactive testes that can be genetic, or it could be the result of an injury, an illness. Sometimes the reason is unknown. We can't really pinpoint why the testes are underactive, but it just happens, right? Aging, as you can see from this graph, it is normal for your testosterone to slowly decrease with age. It's a nice steady downhill slope, unlike menopause, which is an absolute roller coaster and then jump off of a cliff. So I think that's kind of nice, but still getting your testosterone lower doesn't feel great. Hold on, let me let in a few more people here. Okay. Okay. Uncontrolled diabetes. This is one of the main ways that low testosterone can happen. Low testosterone is closely associated with type 2 diabetes in particular. Testosterone levels are influenced by insulin resistance because insulin resistance decreases the levels of sex hormone binding globulin. This is a protein that carries testosterone in the bloodstream. In fact, in one study, 57% of men with type 2 diabetes and 7% of men with type 1 diabetes had clinically low testosterone and didn't even realize it. So my guess is there are a lot of men running around out there who have diabetes who have no idea that they also have low testosterone, probably because they don't have ED, so they think that they're fine. As I said, that is not the only symptom of low testosterone. Another thing that can cause low testosterone is obesity. Fat cells will lower your testosterone by transforming testosterone into estrogen. That's right, fat makes estrogen. We're going to talk about this much more in the menopause section, but it's kind of crazy. Sometimes we'll see this when we do Dutch testing. A lot of people think that Dutch testing is only for women because women have more complicated hormones, but you can absolutely get a Dutch test as a man as well, and it will test all of your different hormone levels. And men make estrogen and progesterone too, just in much, much smaller quantities than women. And women also have testosterone, of course. We all have all these hormones, just varying different degrees. But I will see this with men who have been taking exogenous testosterone for a long time. When they first start taking it, they feel great. Everything is wonderful. And then over time, their body starts to convert this extra testosterone into estrogen. So even though their testosterone levels are well within range with this exogenous testosterone, their estrogen is even higher in relation. So they'll have signs and symptoms of low T, even though the testosterone is technically fine because their estrogen is so high. Okay, so, and a lot of that can be due to obesity. Their fat cells are converting the testosterone into estrogen, and they're taking all that extra T and turning it into estrogen, making them feel pretty crummy. Okay, sleep apnea. This is another thing. Anytime that your sleep is disrupted, it's going to mess with your hormones, guys. Period. End of story. Testicular injury. If you've had a serious injury to the testes and they're no longer totally functional, obviously that can inhibit your testosterone production. Use of steroids, opioids, chemotherapy. You know, in some cases you can't help it if you have to take steroid therapy due to like an autoimmune condition, for example, or if you have to take chemotherapy, obviously, so you don't die of cancer. But I do want to emphasize, I think that if we had like a big black box warning on opioids, warning this can plummet your testosterone and cause erectile dysfunction, we would have a lot less gentlemen asking for opioids. So many people don't realize this. And I will have patients coming to me like, you know, I've been taking this for years for my back pain. Now I'm having this problem. I'm like, well, the two are probably related. They're like, oh, that doesn't make sense. I've been taking this opioid forever. I'm like, yes, it takes time. But if you want to help your low testosterone and your ED, you may have to cut back or consider discontinuing the opioid. So definitely something to keep in mind if you're trying to streamline your medication to increase your testosterone levels. Okay. Hemochromatosis, which is too much iron in the blood, that can cause testicular failure or pituitary damage. So that is something that we would test for if you've got low testosterone. And then also emotional or physical stress. This can cause your reproductive system to temporarily downregulate or even shut down. Okay, for those of you who are in the app, if you want more information on that and you weren't there for the stress class, please check out the full-length stress class. We went over this in great detail about how your body will prioritize cortisol and those stress hormones over everything else. But yeah, so just basically know that if you're stressed out, your body is not going to prioritize your testosterone. All right. Physical stress can also include things like viral infections or STDs. So it is important to stay on top of that. All right, let's talk about the ladies now. Like I said, we're going to kind of jump back and forth here. I wanted to keep it interesting for both groups. All right, so symptoms of menopause. A lot of women honestly don't know if they're in perimenopause or going through menopause. Once again, hormone levels are not routinely tested. I think that we're doing women a disservice by doing that. The thing is, with perimenopause, your hormone levels, if you get it tested just one little moment in time through a blood test. Oh, can you guys see me? My computer kind of froze there. Okay, I think we're good. If you just get one moment in time with a little blood test, the problem is that in perimenopause, your hormones may be really high at that moment. We will see women's hormones do this. So perimenopause means that you are down to like the last little bit of your eggs, your last 1, 2, or 3% of the eggs that your body has, okay? So in order to try and squeeze out those last few eggs, sometimes your body will really send out tons of estrogen, okay? Or even sometimes tons of progesterone, but mostly estrogen to try and get those eggs out. So what women are dealing with in perimenopause is an absolute roller coaster, okay? And then menopause is just all of the eggs are gone now, and now we have no hormones, okay? That's when the ovaries basically stop producing hormones. So a lot of times doctors are hesitant to test hormone levels in women dealing with perimenopause because your estrogen may show normal, even though at different points in your cycle, it's all over the place. It may show super high, which then, you know, people are going to start worrying about estrogen dominance and all this stuff when it's not really, it's just your body trying to crank out another egg. Or it could show low, it could show anything. So I get that, but I still think that if we tested a woman's hormones various times and not just one time, that we would be able to get a much better picture of exactly what's going on with her body, give her more accurate information so that she can handle this better and know exactly what's going on. Sometimes just knowing is really helpful, right? Okay. So let me be the first to say that menopause does not just equal hot flashes for a couple of years. This is one of my biggest pet peeves about menopause. That's all you hear about. It is so much bigger than that. It's changes in your muscles, your bones, your cardiovascular health, major changes in your mood, your brain function, your skin, your hair, just honestly, every single part of your body and your mind. One of my biggest pet peeves is that we treat menopause as if only one symptom matters, hot flashes, and that it's not really a big deal and women should just kind of deal with it. To me, that's like saying, well, death is the natural consequence of being bitten by a rabid animal. So if you got bit by a rabid animal, just go die then, right? Like, even though we have vaccines and we have medications that can keep you alive, it doesn't make any sense. That's what would naturally happen, right? Menopause is a natural part of aging. We're all going to go through it. Okay. It's not an illness. It's not a disease. It's just a natural part of life. But isn't modern medicine all about making life better and smoother? Like, a natural consequence of having a heart attack is that most of you would die as well. We don't just sit back and watch someone have a heart attack and say, that's a natural part of aging. No, we help that person. That's the whole point of modern medicine. So why not try to make life smoother, easier, better? It's all about improving people's lives and health. Okay, I will go ahead and hop off my soapbox now, but I just want to make it clear that menopause should be studied more. It's abysmally studied compared to pregnancy or breast cancer, for example, and that there is nothing wrong with women seeking treatment for the health and mental consequences that many women experience going through menopause. Okay, some women just sail right through it, no problem. Others really, really struggle. We are doing them a huge disservice by just not listening to them as they're dealing with all of these incredible physical and mental changes. All right, all that being said, here are some of the classic signs of menopause. And honestly, there's even so much more than this. I ran out of space on the slide and I was like, okay, that's enough. Hot flashes and night sweats, of course. Irregular or absent periods, obviously. Increased belly fat and decreased muscle mass. Okay, ladies, once again, I was just talking about how estrogen can create fat. There is a school of thought. This isn't 100% proven yet. We see the correlation. We're not sure if it's causation or not, but there is a school of thought that thinks as your body notices, hey, these ovaries are really struggling to produce estrogen. We're almost out of eggs. Like, we need more estrogen, that it tends to start to accumulate more visceral fat, which can create more estrogen. Especially, it tends to go right around your belly, which is right where your ovaries are. So it's almost like your body wants to compensate for the lack of this super protective hormone that's so wonderful for our health, estrogen, by creating its own little estrogen factory there, right? This nice little cushion. All right. So that is unfortunately a side effect of menopause and perimenopause. There is also breast tenderness, classic sign, heart palpitations. I see so many women going through perimenopause who are sent up to cardiology for an EKG workup. It's just completely unnecessary. Heart palpitations, extremely common during perimenopause and menopause. Mood swings, irritability, depression, anxiety, all of that, your brain is just going through a real number. Sleep issues, chronic fatigue, especially we see this because of progesterone. So progesterone is a really great hormone that helps you to sleep better. It causes restful sleep. And that's why I always recommend that women take your progesterone at night, if at all possible. If that is completely missing from your body, you're going to struggle with sleep. Okay, decreased libido. Obviously, testosterone is the libido hormone. A lot of times when you're going through menopause, you'll have massive drops in your testosterone production as well. Headaches and migraines, classic perimenopause and menopause symptom. Vaginal and skin dryness. Estrogen just keeps your skin plump, hydrated, healthy. Once that estrogen is gone, you just dry up like a prune, okay? So that's part of it as well. Thinning hair and brittle nails, once again, thank you, estrogen. Brain fog and memory issues, just like the gentlemen that when they start losing out on their testosterone, they go through that. We go through that as well. And joint pain, muscle aches, osteoporosis. Estrogen is incredible for helping with all of those things. All right, once that estrogen is gone, our bone health suffers tremendously. That's why you see older women dealing so much with osteoporosis. It's because they don't have that estrogen. And you'll see all kinds of crazy musculoskeletal things like frozen shoulder. That is a really common thing that women are not aware of. Most women don't realize that going through perimenopause can cause all of these things. Okay, why does menopause happen? Okay, so menopause is technically defined as 12 months without having a period. The typical age is about 50, but it can happen. There's a wide range, right? Some women go through menopause 55, some women go through it in their early 40s, whatever. And the thing is that perimenopause, which is the hormonal roller coaster, usually happens for 7 to 10 years before menopause. So you're still experiencing all these crazy symptoms before you officially hit menopause. Okay, now menopause happens because it is just your ovaries running out of eggs, so they stop producing hormones. It is simply egg exhaustion, no more eggs. So let me dispel a couple of myths that I hear sometimes. First of all, menopause happens to everyone. It happens because your ovaries run out of eggs and you cannot delay it and you cannot prevent it by having a super healthy lifestyle. I don't care if you're gluten-free, dairy-free, have never eaten sugar in your life and exercise 3 hours a day, doesn't matter. You're going to go through menopause. It is literally just egg exhaustion. Okay, so you didn't bring this on to yourself by having an unhealthy lifestyle. That's another thing that women say is, oh, did I put myself in perimenopause? No. The only thing that can put you into menopause quicker is if you have to have like a hysterectomy where your ovaries are taken out, or you go through chemotherapy where your ovaries are damaged, something to that effect, where you run out of eggs quicker. That's the only way you put yourself into menopause, okay? So don't beat yourself up, all right? You can feel better going through perimenopause and menopause with great lifestyle choices, but you cannot prevent it or delay it. Now, once your ovaries are done producing hormones because they have run out of eggs, your adrenals will continue to produce these sex hormones. They can produce the estrogen, progesterone, and testosterone. They just do not make them in near as high levels, okay? So it's going to put extra stress on your adrenal glands, and you're still not going to feel that good because you're going to get just a fraction of the hormones that you were getting from your ovaries, okay? Okay, back to the men. Let's talk about some natural ways that you can boost testosterone via diet. Many men want to boost testosterone because they have low energy levels or some of these other side effects. And it could absolutely be true that you have low T. The only way to know is to actually get a test. But often when we test these men, their testosterone levels are absolutely fine, but it turns out they are nutrient deprived. Okay, because maybe they're not eating enough protein. That's generally not the case. Usually most men love their protein, but sometimes they're not eating enough protein. What I tend to see is that they're not eating enough foods that are rich in vitamins and minerals, or they have hypochlorhydria. Okay, now, once again, my app subscribers, refer back to the heartburn class. If you did not attend that class, you have access to it forever and ever. So check that out. But hypochlorhydria just means not enough stomach acid. So many people have that these days because a lot of people are taking PPIs or taking other chronic medications that decrease your stomach acid. It is going to severely inhibit your body's ability to absorb nutrients, including protein. Okay, as someone speaking from experience who had hypochlorhydria and had no idea, I was severely protein deficient. I was eating 100 grams of protein every day. Okay, and when we looked at my actual blood work, I was severely malnourished in protein. It looked like I never ate any protein. It was absolutely wild to see it in black and white. Okay, so it's a very big deal. If you are taking a PPI every day, or if you have undiagnosed hypochlorhydria, please look into that, okay? Because it can absolutely crush your body's ability to absorb things and to have the proper nutrients to have the energy that you need to live life in this crazy world that we're living in. Okay. So, and that can also help with weight loss as well, you guys. If your body is crying out for more nutrients because you're severely nutrient deprived, it's going to lead to increased appetite and weight gain and even more lethargy. Once again, with another vicious circle here. All right. So dialing in your diet is a super important step that so many men want to skip because they want to go right to a pill or an injection, you know, the simple, quick answer. We always want that. I get it. I'm not judging you. I feel the same way. I would love to just be able to take a pill and have everything solved. But you need to dial in these other things as well. Don't just skip right over the diet portion. Okay, so things that you can have in your diet. Fatty fish, super, super important. Low-fat diets and diets high in saturated fat are both correlated with low testosterone. So if you're eating a low-fat diet, you might have low T. If you're eating a diet super high in saturated fat, you might have low T. If you're eating a diet that has plenty of the healthy fats, the unsaturated fats that you find in avocados and fatty fish, all of that type stuff, you have a much better chance of your testosterone being in the proper range. Also, vitamin D. Low vitamin D levels also correlated with low testosterone. Get your vitamin D checked, people, okay? It's cheap. It should be free through your insurance. So ask your doctor to check it the next time you get blood work. All right, dark leafy greens. These are high in magnesium, which is absolutely crucial for testosterone production. Several studies point to low magnesium being correlated with low testosterone as well. Cocoa, who knew? But cocoa is high in magnesium and antioxidants. It's also anti-inflammatory. Try to go for the dark chocolate rather than the ones that are higher in sugar. It's actually kind of a health food, okay? Maybe I'm just telling myself that because I love to have a little square of dark chocolate every day, but I consider cocoa a health food. Avocados, once again, full of those healthy fats, full of magnesium, and this is key, avocados have boron. Boron may protect against testosterone degradation. Sometimes your body is producing plenty of testosterone, but it is degrading quickly, or it's being converted into estrogen too quickly. Okay, so making sure that you have all of the pieces of the puzzle are important to keep your testosterone in the right range. Berries, cherries, and pomegranates. These are all high in antioxidants. And one study actually showed that giving athletes pomegranates increase the levels of testosterone in their saliva. Like, boom, these athletes ate pomegranates for a few days, their testosterone is already increased. That is wild, okay? And all of these things also help protect against inflammation. They're very anti-inflammatory foods. Shellfish. Shellfish are an excellent source of selenium, zinc, and omega-3. That is such an important thing, okay? Zinc is super important for male fertility, so I want to kind of include it here, but doesn't necessarily help with testosterone production. But every time that I talk about testosterone, I always try to mention, if you are trying to get pregnant and you're struggling, make sure you're getting enough zinc as a gentleman, because without it, you cannot produce sperm. All right, another thing that can help is intermittent fasting. I find this so incredibly helpful for the gentlemen. For the men that I work with, I love intermittent fasting for everyone, including women. I do it myself, but I will say that men do so well on intermittent fasting. It's crazy. Like if I put a man and a woman on the same diet, she's going to lose 1 pound per week and kind of struggle. He's going to drop like 5 pounds in the first week. I swear, intermittent fasting just works incredibly for so many men. Now, this isn't for everyone. If you've got hypoglycemia or some pre-existing health condition where you cannot do it, don't do it. But in general, intermittent fasting seems to work really well for a lot of men. So you can do like a 16-8 fast. That's the most common, the most typical, where you fast for 16 hours out of the day and you do all of your eating in an 8-hour window. And let me say, one of the biggest keys is have that eating window early, okay? We have so much data pointing to the fact that if you're skipping breakfast and eating a late lunch and then dinner, that's not helpful. It might help you because you're eating less calories just because you're eating less time of the day. But as far as the other benefits that come with intermittent fasting, you're just not getting them. Okay, we have so many studies proving this time and time again. Early eating window is key and no snacking after dinner. So keep that in mind. And I will be doing an entire class on intermittent fasting soon, so stay tuned for that, but that's enough for now. Okay. There we go. Okay, natural ways to boost testosterone lifestyle-wise. Number 1, get a good night's sleep. Just 1 week of reduced sleep dropped men's testosterone levels in clinical trials. 1 week of reduced sleep, not even like, they were just getting like an hour or 2 less of sleep. So it's not like they were being kept up for a week straight. And of course, their testosterone was reduced. Just 1 week of getting a little bit less sleep reduced testosterone. So imagine if you are going on years of not getting enough sleep, what that is doing to your hormone production. Number 2, maintain a healthy weight. Once again, fat converts testosterone into estrogen. Okay, I really want to hammer that home. Number 3, balance your blood sugar. Increased blood sugar decreases testosterone levels by up to 25% in clinical trials. We just talked about how over half of the men with type 2 diabetes had low T and had no idea. There you go. All right, next, get moving, particularly resistance training, because that improves your muscle mass, which is another piece of this whole puzzle. Too much intense cardio for a long period of time, so endurance training for hours, will actually reduce your testosterone. Short-term high-intensity interval training will improve it. Resistance training will improve it. Nice and easy exercise for a long period of time. So if you want to go for a 2-hour walk, go for it. That's great for you. But if you're trying to do like a 2-hour run where you're like running intensely, that might actually hurt your testosterone levels. Okay, so just keep that in mind as you're kind of designing your workout routine. Decrease alcohol consumption. Just 5 days of drinking alcohol in a row decreases testosterone levels in trials. 5 days. So imagine if you're having a couple beers with dinner every single day for years, what that is doing to your testosterone. Try to use glass and not plastic when you cook, or try to avoid water bottles. Just try to avoid plastic in your life as much as you can, because BPA is a chemical found in many plastics that mess with your hormone making process. After 6 months, men who started working around BPA had decreased levels of testosterone. Especially avoid heating up plastic. If you've got to store things in plastic sometimes, I get it, you know, modern life, it's kind of really convenient, right? Do not heat up plastic in the microwave. Don't do it. Put it in glass, put it on a microwave safe plate. Stop heating up plastic. That is when it really leaches into your food products, okay? Minimize stress. Like I said, refer back to the stress and anxiety class for more information on this, but your body will prioritize cortisol production above everything else. It does not care if you're getting laid, which is what your testosterone is for, if it feels that it is under threat, okay? Review your medications, especially opioids, as I said earlier, and also spironolactone. For you gentlemen who are taking spironolactone for blood pressure, at low enough doses, probably okay, but once you start getting into higher doses, it will definitely decrease your testosterone, and it's very feminizing. In fact, we will see that it actually can cause men to grow breasts. So something to keep in mind. Okay, natural ways to boost testosterone via supplements. We got lots of options here. Oh, I'm trying to go through these quickly. This is hard. Okay, so number 1 is ashwagandha. Probably the most testosterone boosting abilities in clinical trials are with ashwagandha that I have seen. We will see that testosterone increases with just 8 weeks of ashwagandha supplementation. That's huge. It also helps with anxiety and mood, just as a bonus. Please, please, please talk to your doctor before you start ashwagandha. It interacts with everything under the sun, okay? It interacts with blood pressure medications, blood thinner medications, diabetic medications. If you've got any type of health condition, you need to use ashwagandha with caution, okay? I will say my favorite one is from Designs for Health. You guys know I love them. It's Triganda. It's got 3 different ashwagandha extracts, and I absolutely love it. I do use it myself. Okay. The next thing is omega-3. Omega-3 reduces inflammation throughout the entire body. It's cardioprotective. It also is protective for your brain. People are always asking me about brain health supplements. Omega-3 by far has the most evidence. Okay, not all of these other things you're hearing about, lion's mane and crazy mushrooms and everything. Omega-3, easy peasy, right? And it's got all these other great things about it as well. We also have noted that infertile men have lower levels of omega-3. So there is a correlation between fertility and omega-3 in men, all right? Zinc, once again, I like to bring it up just in case anyone out there is dealing with infertility. It does improve sperm count. It is great for men looking to make a baby. It doesn't actually boost testosterone. And guys, please do not start willy-nilly taking zinc without getting your levels checked, because too much zinc can lead to decreased HDL cholesterol, that's your good cholesterol, and copper depletion. Okay, so you can absolutely get too much of a good thing. The difference between a medication and a poison is the dose. All right, so Just always keep an eye on your levels. All right, maca root. Maca root is pretty good stuff. It's actually shown to improve libido and potentially erectile dysfunction a little bit. The results are mixed, but there's some positive evidence there in some trials. The nice thing about maca root is that it's a plant that has been used for centuries to improve mood and sexual function in Peru. It's pretty innocuous, okay? It's not one of these ones that interacts with everything under the sun. You got to be really careful and you might get too much and all this. It's like easy to use, okay? So that's one of the big benefits of maca. Magnesium. So as I said, low magnesium and low testosterone are correlated. Let in a few more people here. Studies show that low magnesium and low T go hand in hand, and it gets depleted with so many modern medications like PPIs, blood pressure medications, some antibiotics, even insulin. Lots of medications will deplete your magnesium. That is why it's estimated that half of Americans have too low of magnesium. Magnesium glycinate is generally best. It's the one that's best absorbed. B vitamins. These are super important for testosterone production. They provide energy and they support phase 1 detoxification of the liver. This is very helpful for getting rid of excess estrogen. Your liver is what gets rid of extra estrogen. All right. You guys know that the liver and the kidneys, those are the two detoxification organs of the body, right? So if we can support that phase 1 detoxification in the liver with B vitamins, wonderful, right? Okay, now libido stem in. This is my favorite. I love this product for men who are struggling with libido and potentially testosterone as well. So it's got boron, as we talked about earlier. That is what helps protect against testosterone degradation. It's got DIM. Now, DIM is honestly the star of the show when it comes to this supplement. DIM basically slows down the conversion of testosterone to estrogen. I just want to talk about DIM briefly here for a second. I know we're rushing, but the whole point of the class is that you guys learn. So I just find this such a fascinating topic when it comes to DIM. So the thing about DIM is that, as I said, a lot of times men will have a perfectly adequate testosterone level, but they have an overabundance of estrogen. So it's all about the balance of the two, right? And DIM has been shown to inhibit the enzyme aromatase, which is what converts the testosterone to estrogen. We talked before about how sometimes we'll see on a Dutch test that men who are taking exogenous testosterone, they end up with elevated estrogen levels, especially after a period of time. This generally happens after you've been doing it for a few years, right? So many men do great when they first get on the testosterone therapy. A few years down the road, it's not working at all. So they increase the dose. Doesn't help. That's because the testosterone just keeps getting converted into estrogen, right? So DIM can help correct this issue. And it doesn't necessarily have to be from just exogenous testosterone. It can just be your body itself converting things over way too quickly. That absolutely happens in some of us. We're all unique little snowflakes and our bodies all work differently. Some men convert testosterone to estrogen quickly. DIM can help those men, okay? Now, for other men who are not really converting the testosterone into estrogen, they're just having a trouble with production in the first place, DIM is not that helpful. But in my personal experience working with men, DIM seems to be really great for many of them, okay? It can really help to guide supplement or prescription therapy to know exactly what's going on in your body. Dutch tests are expensive. That's the only thing I don't like about them. A lot of times you can get blood tests covered with your doctor. So that's always the way you want to go if possible. You can always get these tests done and by paying cash anytime. Yes, I do offer them. If you're interested, I'd love to work with you. Try to go through your doctor first because it's free. And then if that doesn't work, then I can help you out, right? Okay, so the libido stem M, not only does it have the boron and the DIM, which is absolutely incredible, but it also has a few other things that are helpful for libido in particular, like horny goatweed, tribulus. Tribulus is absolutely crucial for men who want to supplement their way to higher testosterone. It actually increases production, and also ginkgo. All right, so that's a really cool product. I think they did a great job with that one. Okay, a couple other things that you can consider are Broncho Protect. This is another thing from Designs for Health that can help get excess estrogen out of the body. basically by helping with detoxification of estrogen. It's also great for the lungs. So when I suggest Broncho Protect, I'm usually offering it to either smokers or former smokers who also have symptoms of low testosterone, just because it's going to help with all of the damage that smoking has done to their body over the course of years. And it can also help detox, get rid of the estrogen, right? Okay, another thing that you can think about is DHEA. This is the precursor to all sex hormones. DHEA gets converted into estrogen, progesterone, and testosterone within our bodies. So we can give the DHEA as a supplement in hopes that the body will convert it into testosterone. And in men, it usually does. Like, your body is not prioritizing estrogen and progesterone. It's prioritizing testosterone, right? So it's usually fine to give men quite a little bit of DHEA, and it's pretty much going to go to testosterone. So in women, I like to go with a lower dose. I like to go with a 5 milligram dose. In men, I will go 25 to 50 milligrams daily. It's much higher, but I know it's going to get turned into testosterone, and men need more testosterone. Women only need a little. So I find a higher dose a lot more beneficial for men. Usually this is a pretty good way to boost testosterone naturally, unless you already have plenty of testosterone, it's just getting turned into estrogen. So once again, it kind of depends on what your body's doing. Why is your testosterone low? Okay. All right. Now, back to the ladies, natural ways to deal with menopause. Let's talk about diet. Anti-inflammatory diet is absolutely critical. Okay, your body is going through so many drastic changes at this time. You are already going to be dealing with inflammation. All right, even if you have like the perfect lifestyle and your supplements are dialed in, you're still going to have inflammation just because of all of the changes that are occurring naturally. Okay, so you need to try and keep your diet as anti-inflammatory as possible. So what are the most inflammatory things out there that you should try and avoid? Simple sugars. Number one, refined carbs. That's your white bread, right? The stuff that's super, super processed. Gluten and dairy. Okay, I know that it's hard for people to cut those out, and you don't have to cut them out necessarily, especially if you don't have a sensitivity to them. But just an FYI, they are inflammatory for many people. Okay, so trying to reduce the intake of these foods can help so much that it is unbelievable. I recently had to completely cut gluten out of my life. Oh, it's been quite the struggle and journey, but I will say my health has never been better. It's wild the ways that gluten was holding me back that I didn't even realize or recognize. Okay, so an anti-inflammatory diet equals less sugar, less simple carbs, less nitrates and nitrites in processed foods like bacon and deli meat. Yes, those are processed because of the way that they're cured, but you can find nitrate and nitrite-free versions. Okay, so when you're buying your bacon and your deli meat, look for nitrate and nitrite-free if at all possible. It's not always available, but usually you can find it. Fried foods, so inflammatory, so bad for your digestion in your body. Okay, try to avoid them if possible. Saturated fat, bad, just bad. Try to limit it as much as you can. You can't get rid of it completely, but try to limit it. And also alcohol. I know that one's hard to swallow, right? But alcohol is incredibly inflammatory. It affects your sleep. It affects everything in your body. Bad for your liver, your main detoxification organ. So try to limit it as much as you can. Okay, so what should you be eating more of with an anti-inflammatory diet? More omega-3. This means fatty fish, flax seeds, chia seeds, all that good stuff. Berries. Okay, once again, super high in all of those antioxidants. Cruciferous veggies like broccoli and cauliflower. Research has actually shown that women who eat a lot of these cruciferous veggies have better hormone and estrogen levels even post-menopause. So even once the ovaries close up shop and the adrenals are doing all the work, women who are eating broccoli and cauliflower have higher levels of these protective hormones, okay? And they're doing better, all right? Spices, you want to increase your spices, your tea, your nuts, your bell peppers. Just eat the rainbow, okay, guys? Eat the rainbow. Keep it varied, all right? We want a large variety of fruits and vegetables. We want antioxidants and we want polyphenols, okay? Another important thing that you can do with diet is to increase your fiber and your protein. This is super important as we go through perimenopause and after menopause as well. Our digestion slows down as hormone levels drop, and fiber will help to keep things moving. It's also important for cardiovascular health. Fiber will actually help to keep cholesterol and blood pressure in check. You should aim for a minimum of 25 grams per day, but we see benefits through 35 grams. So if you're getting 35 grams per day, even better, okay? It is best to get your fiber from food if possible. If you cannot get it from food, go ahead and supplement, absolutely fine. It's kind of, I don't know, I see different things in literature. I will say psyllium husk has the most evidence as being the most beneficial fiber, but it might be best to kind of get all of the different types of fiber if possible, okay? Soluble and insoluble, all that good stuff. Protein will help prevent muscle wasting, sarcopenia, all that. As we age, we generally actually need more protein. Now, if you have kidney disease, kidney failure, something like that, please check in with your doctor before adjusting protein levels. But in general, it's better to have more protein during this time frame. I myself aim for between 80 and 100 grams of protein per day. We also know that diets high in fiber and protein help with weight maintenance. They help you to feel fuller longer, all right? The next thing is focus on getting the right macronutrients instead of counting calories. Yes, this is so important. I know so many of you, I'm sure, are like me, where all you did your whole life to maintain your lovely weight was count calories and cardio. Calories, cardio, that's it, right? That's like all I ever did. And I would just eat like, you know, if I had gained a few pounds and wanted to lose it, I'd just eat like 1,200 calories a day of pure candy, literally, and then just go running, do some cardio. And I know a lot of you are the same, right? Guys, that is not the picture that is going to help you through menopause and perimenopause. Your macronutrients matter so much more than your calories. Hitting your protein goals, hitting your fiber goals, that is so much more important than the actual quantity. And let me tell you, it's hard to eat 2,000 calories of whole foods. I'm telling you, once I switched my diet from like highly processed foods to like mostly whole foods, so many days I struggled to get in enough calories. I know it sounds crazy, but I literally eat like 1,500 calories a day and feel like I am absolutely stuffing my face at all times. I'm just like always full and I'm like, oh God, I got to eat again. Like I'm still full from the last meal. But that's what it's like when you're eating whole foods. You have to eat so much to eat 500 calories of salad versus like a 500 calorie candy bar is like this big, right? Okay. Another thing that can help is eating foods that naturally have probiotics. Things like yogurt, kimchi, kombucha, soft cheeses, sourdough bread, only the real stuff, not the stuff that you buy at the grocery market, sauerkraut, apple cider vinegar, kefir, etc. I've got this written down in the ebook that you're going to get. You can also just Google it. Try to eat one of those every day. Super, super helpful. Probiotics are great as well, but when you can try and get some of this from food, even better. All right. Intermittent fasting, yes, I think it works even better for men, but I do also think it's very helpful for women going through perimenopause and menopause. It helps you to eat less without obsessively counting calories. It helps your digestion to work more effectively. It boosts metabolism. Just look for the intermittent fasting class coming up. You guys are going to get so much more detail on this. Okay, more natural ways to deal with menopause via lifestyle. This is going to look very familiar because it's exactly the same as what I just said to the men. So I'm not going to repeat everything. The recommendations are the same. I do just want to highlight how incredibly important resistance training is for women, okay? I don't have to convince men of this. They're already on board. They know that they should be lifting weights. But many women have neglected resistance training because they have relied solely on cardio and counting calories to maintain their weight their whole lives, and it always worked. That's the thing. Like back in the day when I was eating pure candy and running, I was an ideal weight. Everyone would look at me and be like, wow, you're so healthy. I wasn't. I was kind of rotting on the inside, but you couldn't tell. And I know that a lot of you are in the same boat. You know, all of us, Gen X, millennial, boomer, like we all kind of have the same vibe when it came to what we've done our whole lives to maintain our weight. And then all of a sudden you get into perimenopause and it doesn't work anymore. And then you're like scratching your head, right? So please do your resistance training, ladies. It's so incredibly important. And also It is the best thing to prevent osteoporosis, okay? It is so much better than calcium supplementation, all right? Calcium supplementation can lead to calcification of arteries. Don't do it unless you absolutely have to under a doctor's instructions, all right? I hate it when I see people taking calcium willy-nilly without a doctor looking over their shoulder. Calcification of arteries can happen so easily. Okay, some more natural ways to deal with menopause. Once again, ladies, we got lots of options, which is nice. And ashwagandha shows up on our list as well. It is also incredibly helpful for women going through menopause. It helps with stress response, mood changes, and libido for us also. Please check in with your doctor before using it. It interacts with a lot of stuff. Omega-3. Omega-3 is great. We know that it helps with our heart. We know that it helps with arthritis, all of these incredible things. It is also proven in clinical trials to decrease the frequency of hot flashes, as well as helping with the inflammation, the cardiovascular system, the arthritis, and all of that. So it's a win-win-win, right? In my opinion, most people should consider using omega-3. There are some people who can't for various health reasons, but for the rest of us, it's a great idea. Okay, maca root can help the ladies just like the men with libido. Magnesium, once again, it keeps the digestive system moving. It helps with sleep, and many menopausal women complain of insomnia due to the fall of progesterone, right? It can also help with mood and stress, and it gets depleted with so many medications, so consider magnesium. And I do want to talk about libido stem F, libido stem F. It's hard for me to say for some reason. So the libido stem M means libido stem for men. Libido stem F means for women. And I'm going to highlight this supplement in particular because there's actually, I know I rave about Designs for Health supplements all the time. I love them because they're third-party tested. I think most of their stuff makes a lot of sense. But when it comes to menopause, I feel like they really dropped the ball, okay? They have a supplement called FemGuard HF, and they also have one called FemGuard Balance. I don't like these supplements. They didn't make sense to me. When I read the ingredients, I was like, okay, maybe they know something I don't, right? Maybe in their own trials, this actually worked really well for women, whatever. So I actually went ahead and bought a bottle of the FemGuard HF to try out myself. And you guys know I normally rave about Designs for Health supplements. I'm like, oh my gosh, I started this and it's been so great. I love it so much. I did not notice anything with FemGuard HF. So just looking at the research, I'm not really sure why they chose the ingredients that they chose, and then trying it personally, I don't get it. So just my 2 cents, I would skip the FemGuard products from Designs for Health. They don't make sense to me, but they do have another product I do love that I think can be beneficial for menopause, and that is the libido stem, which is specifically designed for libido, but it's got other ingredients in it that help with other menopause related symptoms. So I'm like, why didn't you guys label this one for menopause? Throw out the other stuff. It doesn't work, right? Okay. So the cool thing about this product is the main star is DHEA. All right. So it's got the low dose for women. It's got the 5 milligram, which I really appreciate that they did not put high dose DHEA, because when we see that happen, a lot of times, we'll see it being converted into too much testosterone for women. We want to keep them at a lower amount, right? And it's just the right amount. It gives your body what it needs to help those adrenals to keep pumping out the hormones that you're missing, the estrogen, the progesterone, and the testosterone. I love it. And most people that I have recommended this product to liked it. So not everyone. There have been a couple of people who were like, I don't think this one really worked for me. But for a lot of people, they really liked it, and they found that it improved their libido as well. So I think this is a valuable tool to have in your menopause toolbox, okay? They have another product I like from Designs for Health, and that is Progestaveil. This is actually a topical bioidentical progesterone. Okay, so it can help with those decreasing progesterone levels. So if that's specifically what you're struggling with and dealing with, this can help. Now, it's not going to do anything to address estrogen or testosterone. It's only progesterone, but I love that we have this option. I think that's very cool. Okay, another cool supplement that can potentially help is chastaberry. This acts on the pituitary gland to promote the production of progesterone. Once again, progesterone really is great for like helping you to feel better. It's really good for helping with the mood swings, for helping you to sleep more. That's what progesterone is all about. With estrogen, we see more of the health benefits, like the osteoporosis prevention, the cardiovascular risk prevention, health with your skin, okay? All of that. So that's kind of the picture there. Now, with chasteberry, the evidence in clinical trials is a little bit sparse, but I know a lot of women who have had a lot of luck with this supplement. It's one that I tend to not generally recommend because the evidence is like, meh. But I'll tell you, almost all the women who have tried it that I've spoken with are like, I love my Vitex or my chasteberry. So I'm like, I don't know why it's not showing up in the clinical trial data quite as effectively, but most women who try it that I have talked to love it. So it is what it is, right? Okay, topical DHEA, this is another option. This can be applied directly to the vulva for vaginal dryness. It works similarly as a topical prescription for estrogen cream, for example. So if you're having trouble accessing the topical estrogen cream, you could think about the topical DHEA, which is available at OTC. Now, Bezwecken. This is such an interesting option. If you just literally Google Bezwecken, it'll pull up their website. This is basically hormone replacement therapy light. This is a company, Bezwecken. So this is available OTC, and I love that this is available OTC. So many women have trouble getting these hormone replacement therapy medications from their doctor. They're being dismissed, they're being ignored. So I love that this OTC option is available. It's literally like bioidentical estrogen or estriol or estradiol or DHEA. It's got all four of those. It's interesting, right? That you can just grab that OTC and have it shipped directly to you. Now, please use these cautiously and use them carefully. Yes, they're available OTC, but you're still talking about hormone replacement therapy. Okay, so don't go crazy and willy-nilly with it. I do also love the fact that their products are generally topical, or they have some vaginal suppositories as well. But once again, that's like locally acting, right? Versus more of the oral systemic therapy. Okay, so very cool option. If you're struggling and you can't seem to get hormone replacement therapy, but you're wanting to, you can definitely look into Bezwecken, okay? And it's a much lower dose also than the traditional HRT. Okay, so let's talk about pharmaceutical options for low T. It's always my favorite part, going to the prescription meds. And guys, I'm trying to go as quick as I can. I know we just hit an hour. There's just so much to talk about. Okay, so my favorite option for low testosterone is Clomid. That's right. Now, some of you may have heard about Clomid because it's used for female fertility. It also works for men. It can be used for male fertility, but also low testosterone. So what Clomid does is it causes an increase in the FSH and LH secretion, those really important hormones that ladies, you know, have a lot to do with your cycle. Men also have those hormones. The increase in those causes an increase in sperm production and testosterone secretion. Okay, so very, very interesting. It's used for infertility as well as low T off-label for men. Now, it does take 3 to 4 months to take full effect. So don't start taking it this week and be like, I don't know why it's not working. It takes months because what it does is it slowly boosts your body's own production of testosterone. I love it. It's kind of like taking low-dose naltrexone for pain and other problems. You know how that causes your body to increase its own production of dopamine. Clomid increases your body's own production of testosterone. All thumbs up here. I think it's a really nice way to boost testosterone without dealing with the drawbacks of exogenous testosterone replacement therapy. In fact, only 8% of men report side effects with this medication. That is incredibly well tolerated. 8%, that's great, right? The nice thing as well is this is not a lifelong commitment. So when you start taking testosterone, it is a lifelong commitment, okay? You are down-regulating your body's own production of testosterone. So if you suddenly stop taking the exogenous testosterone and you have shut down your body's own production of testosterone, now you'll have no testosterone. You don't want that, right? So if you start taking exogenous testosterone, just know you're in it for the long haul, okay? You're down-regulating your own production. That's not going to be there anymore. Clomid isn't like that. It helps your body create more. And if you stop taking the Clomid, then you'll probably just either go back to how you were, or hopefully it'll still stay at higher production. But you're not down regulating your body's production of testosterone, you're up regulating it. So that's what I love about it. Great, great option. And most of the men I know who take this really, really love it. Yeah, it's like a win-win-win. Now, of course, the next option is testosterone, TRT, testosterone replacement therapy. Now, there's no judgment here about, potentially taking a hormone that you're going to have to be on for life. The fact is, I just want you to know this ahead of time so you can make the appropriate decision and the best choice for your life, yourself, your goals, your lifestyle. Okay. And I will say that Clomid is wonderful, but it's not as strong as exogenous testosterone. So trying to get your body to boost its own testosterone production, it works great for a lot of men. For some men, it's still not enough. They just need more testosterone. All right. So just be aware of that. All right. Now, TRT does come in several forms. It comes in a patch that is applied once daily. It comes in a gel that is applied directly to the skin, or a gel that's actually applied inside the nose as well. It comes in a mouth patch that sticks to the upper gums that you put on twice daily. And then, of course, injections that go directly into the muscle. I think that's probably the most common one that I personally see in retail pharmacy. There's also the pellet option where it just kind of like slowly releases into your bloodstream over time. Now, as far as the risks of testosterone replacement therapy, it includes benign prostate hyperplasia and prostate cancer. We know that testosterone kind of feeds into an enlarged prostate and prostate cancer. So if you're increasing the testosterone, you're going to be at higher risk for both of those. All right. Sleep apnea, blood clots, anger issues, and mood swings. I just kind of find this one funny. So I have never had a man complain to me that his testosterone gave him anger issues. Never. I have had so many wives complain to me that their husband has anger issues while taking testosterone. I just find it funny that the men don't notice or don't care or don't bring it to my attention. I have never in my life had a man say to me, I feel like taking this testosterone, that I'm a little more angry and I fly off the handle. Never. Their wives come into me all the time and they're like, I've got to get him off this stuff. He's just a rageaholic. He's flies off the handle. Like he used to be so nice and now he's just, so just be aware that if you take testosterone, be patient with your loved ones. Okay. You may not realize how much it is affecting your mood. Okay. And I also want to be clear as well, because some, like bodybuilders or whatnot, they will try to take testosterone and steroids in order to build up their muscle mass. That is very different from what we see with testosterone replacement therapy. So with TRT, we are aiming to bring the testosterone to natural levels, naturally found within the body. All right. When bodybuilders are doing this stuff, they're using crazy high doses. They're doing terrible, terrible things to their body. That is just never good. Okay. Now, testosterone replacement therapy used judiciously can absolutely be great. All right. So I just want to make that clear. All right. Now let's talk about some pharmaceutical options for menopause. Now, for women with a uterus, that's people who have not had a hysterectomy, estrogen plus progesterone is best because unopposed estrogen can lead to an increased risk of uterine cancer. All right. So this combination of the estrogen plus progesterone, it's usually only used for about 10 years because the progesterone will increase your risk of breast cancer very slightly. Okay. But it will increase it. All right. Another important thing to note, please talk to your doctor about this if you want to start hormone replacement therapy, ladies, is that the risk of breast cancer is higher with daily oral progesterone therapy. You will decrease your risk with cyclical progesterone therapy. So you could take 1 or 2 days off a week. So only take your progesterone on weekdays, for example. Or you could only take progesterone for 14 days out of the month to kind of mimic a cycle. And that will greatly decrease your risk of breast cancer. I think it's something worth looking into that not a lot of people talk about. So please talk with your doctor about cyclical progesterone therapy, okay? Now, women without a uterus can use estrogen alone forever, literally forever. There's no time limit on it, okay? So there is no increased risk of breast cancer by taking estrogen. In those with a history of hormone receptor positive breast cancer, it is recommended to avoid systemic HRT, but topical HRT may still be an option. Okay, so the topical form of these hormones is generally much better tolerated and safer. So the topical form of estrogen, for example, does not have an increased risk of blood clots. Let me say it again for those in the back. Topical estrogen does not have an increased risk of blood clots. So many people are told that they can never have hormone replacement therapy because they've had a history of blood clots. This is not true. Find a new doctor. Now, with oral estrogen, true. You cannot take oral estrogen if you have a history of blood clots, all right? Because it will increase your risk. We don't see that risk with topical, all right? So I wish I could shout it from the rooftops. All right. Now, another thing that I wish people would realize is that birth control pills are massive doses of hormone replacement therapy. And it drives me crazy that doctors are willing to hand out birth control willy-nilly to everyone to prevent pregnancy. But then when you want the exact same medication, but at much smaller doses, 10 years later, because you feel like crap, doctors are like, no, deal with it. Toughen up. Okay, for the last 30 years, you had no problem giving me this. Now, all of a sudden, I'm not allowed to access it. It just doesn't make sense to me. You know what I'm saying? So birth control, hormone replacement therapy, the same, except the dose is even smaller with hormone replacement therapy. That is like one of my biggest pet peeves. Now, I will say that it is best to try and keep the hormone replacement therapy to as low as possible with relief of symptoms. So an estradiol patch, I think that's like probably the best option out there. Honestly, I love it. It has great data to it as far as safety and efficacy. It comes in doses as low as 0.025. So try for that dose. If you're still having symptoms, you can always increase, right? And what you do is you apply the patch, the estradiol patch, to the lower abdomen on clean, dry skin. Rotate the area where you put the patch. All right, don't keep putting it on the same spot. And typical dosing is 2 patches per week. There's also spray or gel versions. What you would do is apply those to clean, dry skin on the inside of the forearm and wait 2 minutes before dressing. Do not rub or massage it. I also wanted to talk briefly about bioidentical versus synthetic HRT. So bioidentical means the product is identical to the hormones that your body produces and usually derived from plants. Okay, these are generally compounded and tailored specifically to you and your needs. Synthetic hormones are also chemically identical to the hormones in your body. I think that the word bioidentical is pretty misleading considering that they're both identical to the hormones in your body, but that's just my 2 cents. But the difference is that synthetic hormones are made in a lab and they come in very standard doses. You won't generally see them in a compounding pharmacy, for example. So it's really about patient preference and what you're more comfortable with. Do you want a regimen that is tailored specifically to you from a compounding pharmacy, or do you want something that is standardized and FDA approved? So less options here, but it's also FDA approved and studied more. Tons of options here, but it's not FDA approved or studied, right? Now, I will say that both appear to be equally effective and equally risky in clinical trials. So there's not one that is like superior in the data, or I'd tell you. You guys know I'm always looking at that kind of stuff. To me, they look the same. They both seem to work just fine. For me, myself, I prefer the FDA standardized dosing, but you know, no judgment on those who prefer it the other way. Like I said, it's literally just patient preference. And, you know, price, I would take that into consideration as well. All right. So testosterone is also available for women. It is available in a couple forms. There is the pellet form. I'll be honest with you, I'm not a fan of the pellet form. The doses are normally way too high. Like it's putting women's testosterone in a crazy zone. But I will say many women love it. I've talked to several women who absolutely love their pellets. So if it's working for you, great. But I just think that the dosing is really high. Now, I do like the compounded testosterone in lotion or gel form. This is a great option for women who are really low in testosterone or who are struggling with low libido, muscle loss, anything like that, because testosterone super beneficial for those things. Okay, now here we go. Here's all of your free goodies. All right, as far as your 2 free ebooks, for those of you who are not in the app, go to www.regenesisrx.com and you should see 2 free ebooks, one on menopause and one on testosterone. Once you go to there, click on the education tab. All right, you're going to see several tabs at my website. Go to education. That's where all my free classes are, all the free ebooks, all the goodies. All right, so enjoy. If you're interested in advanced testing, like I talked about earlier, like with the Dutch testing, or if you want to meet with me one-on-one, you'll also see a link for that there. And let me just say, got to do a quick plug for my app. It's great. Please join it. We have a lot of fun there. You're going to get so many resources. It's absolutely unbelievable. And I literally made it as cheap as humanly possible. I put it for $6. That's highway robbery, if you ask me. So let me get off this screen share so I can start answering some questions. All right, let's bring back the chat. I can hear you and see. Okay, great. My doctor won't test my hormones. Oh, that makes me so angry. How do I get my boyfriend's doctor to check his testosterone level? He has type 2 diabetes. He says he saw a specialist years ago at Cleveland Clinic and swears there's absolutely no way. Okay. He refuses to see any veggies but corn, peas, green beans, tomatoes, and lettuce. I want to help him. It's been at least 5 years since he saw the specialist. Okay. So, well, I mean, you can, I can check for testosterone levels personally if you want to go through me. If the doctor absolutely refuses to test the testosterone. Guys, I can order blood tests, urine tests, whatever. So you can always order them with me. The problem is I can't bill your insurance. Now you can use your FSA or HSA card, okay? But I can't bill your insurance, so that's the problem. All right, let's see. I have menopause, had a full hysterectomy. Progesterone, yes, progesterone is prescription only. I'm not on any meds right now. I've been doing a kind of chocolate mousse with avocado, dark, ooh, not chocolate mix and light. Oh, that sounds amazing. Then I rehydrate with dried dark cherries. Someone gave me a huge back last year. Okay. With pomegranate juice and a couple packets of stevia. That's amazing. I then mix that with a little light cream cheese and spread a layer of that on top of the cocoa avocado. Place in the fridge. Oh my gosh, that sounds fabulous. That is amazing. Oh my gosh. Adrienne, send me the recipe. That is so good for you. That is so good for you. You literally hit like all of the key things there. I absolutely love it. And if it tastes great, all the better. A 2x2 square is 100 calories. That's great. Thank you for the Zoom today. I have 2 questions, please, if I may. First is, how do you feel about protein powders to replace a meal or even as a snack? Okay, so yes, I think that protein powders can absolutely help, especially if you're trying to increase your protein intake and you're struggling. I relied on protein shakes for literally probably a year. I just recently got off of protein shakes. So they were very helpful to get my protein up because I was used to eating like 10 to 20 grams of protein per day. And then I tried to jump up to 80 to 100. It was really hard. So yes, if that helps you, go for it. Now, I will say I don't like the whey protein powders so much unless you get the really expensive kind that are like cold pressed, that don't have all of the junk in them. Most of the whey protein powders I'm not a fan of. I tend to prefer pea protein or even beef protein. So that's kind of my 2 cents on that. Some people love the whey. I get it. I just feel like they're like lower quality and have extra junk in them. And then second is OTC cough syrup. Do you recommend for an upper respiratory cough, especially at night? To be honest with you, I really prefer the more natural method. So there is dextromethorphan, which is available OTC. It's an okay cough suppressant. It's really the only over-the-counter cough suppressant. It's what's in Delsum, Robitussin, everything. I think it's better to stick with things like honey and Vicks if possible. Sometimes we can see, like in children, for example, that the dextromethorphan can actually contribute to pneumonia because it's too good at its job, honestly. And then I don't know. Yeah, I just prefer the natural things better, okay, than the dextromethorphan. Um, that's just kind of me. I mean, I know a lot of people use it and like it. So, but yeah, there's really only one cough suppressant OTC. So that's the dextromethorphan. If you can stick with the honey and the menthol and all of that, I think it's a little bit more helpful. Oh, thank you so much, Lucy. Do you think soy protein powder is a good option? Soy can be for women. Now, I will say I don't love soy for men just because, once again, it can kind of like be a little bit of a precursor to estrogen. It can kind of mimic estrogen. So now for women going through perimenopause, soy can be absolutely therapeutic. So yes, if you are a woman going through perimenopause or menopause, load up on the soy. Okay. It can mimic estrogen. It can make you feel better. I probably honestly should have mentioned it as a supplement option because women will even supplement with soy to alleviate some of these symptoms. But yes, soy can be a great option for women. If you're a man, I'd probably stay away from it. How do you financially manage the vitamins monthly? I'm not exactly 100% sure what that means. I'm 6 years postmenopausal. I experience a lot of the symptoms you mentioned, especially the belly fat, which I never had before. Can I still? Yeah, absolutely. You're still in the window. You're in the window. Okay. So I should have mentioned this in the class, so I'm really glad you brought this up. So basically, when it comes to hormone replacement therapy, if you start it within 10 years of going through menopause, it helps. It helps all the things. It's cardioprotective, helps a lot of osteoporosis. It decreases your risk of everything. It decreases your risk of mortality. It's good for you. Now, if you are beyond that 10-year mark, after you officially hit menopause, the data starts to get a little bit more dicey. Okay, now we see more increased risk and less benefit. You're still in your window. Go for it. Yes, talk to your doctor. I'm telling you, nothing will help you more than getting hormone replacement therapy. Now, you can absolutely dial in your diet, your exercise, all of that stuff, and it's going to help alleviate symptoms. But at the end of the day, if you have suddenly lost all of your hormones and it's causing all these things and you get the hormones back, it's going to help tremendously. 64 years old, adrenalectomy several years ago, now increased visceral fat. How to increase adrenal function. Oh, yeah. Okay, so all right, Dana. Now, when it comes to adrenal function, definitely, I hope you're an app subscriber. I think you are. I think you are. Not 100%, but I think you are. Please check out the stress and anxiety class because that was all about adrenal function. Okay. And how to guys, my throat is killing me. I'm so sorry. Ooh, it's a lot of talking. And how to maximize your adrenal function. So please check out that class. Check out the ebook that went with that class. Message me if you have any more questions. I think it's going to clear up a lot for you. Thanks. I am taking it and feeling awesome. Awesome. Maca protein powder, is that good? There's a maca protein powder. Interesting. Okay, I didn't know about that. So maca root, I've got one here that's like liquid. You see it in lots of different forms, but I have not heard of maca protein powder. Very curious. I will have to look into that. Any soy protein powder preference? Not really, Don. So I don't currently use protein powder myself. So to be honest with you, I've never used a soy protein powder. When I was using protein, I did use whey for a little bit. I know it's so bad, but then I learned, okay, we all make mistakes and we learn from them. And then yes, the pea protein, that's probably my favorite. I've never personally used a soy. So I would try to go for one that doesn't have so much junk in it. I would try to go for one that has fewer ingredients if possible. Try to get it from a reasonable company and, just go for it. Any thoughts on perimenopause and IUD use? I mean, I just feel like everyone's situation is different. There's nothing wrong with it. Absolutely. Using an IUD, it's very local. It can help with some bleeding symptoms. Dealing with perimenopause. It's funny because a lot of people tend to think until they go through perimenopause that you just slowly have less periods and then they disappear. A lot of women going through perimenopause just bleed all the time. They're bleeding for 2 weeks and then they have a week off and then they're bleeding again. It's a nightmare. So the IUD can definitely help with those symptoms. So yeah, I mean, sure, if it's doing good things, absolutely, why not? I love the fact that IUDs are generally local. I don't love birth control in perimenopausal women. I don't love birth control in any woman over the age of 35, the pill, because it will increase your risk of blood clots. It's actually pretty dangerous. I just received my bottle of Acromantia yesterday. Also, can I use an Apple gift card on your app? Ooh, that's a great question. Honestly, I don't know, Chuck. Try it and let me know. Let me know if it goes through. I would think so. Oh, Jockey Edgar Picard told me about the maca protein powder. Hey, jockeys. I ordered it to give it to my 95-year-old granny's tea to help her gain weight. Awesome. I hope it works. Yeah, let me know. Maca root preference. To be honest with you, I ordered one off the TikTok shop, okay? And I liked it. So I really didn't do like a ton of in-depth research. I just really wanted to try it. And I saw it on TikTok and I was like, let's try it. And I liked it. It was cool. I didn't reorder it because I don't really need it, but I thought it was cool. My preference is pea protein too. Yes, Adrian. Adrian, you're so smart. I love you in all of these classes. You have the best comments, I swear, every time. It just feels better in my system. Yes, yes, yes. But it's much silkier. Yes, I agree with you completely. And it's very innocuous. It doesn't cause reactions in a lot of people. That's another thing with whey is some people will get sensitivities to it and they don't even realize it. Pea protein, like almost no one reacts to it. It's fairly rare that you see someone who has a problem with peas. It did help her gain. Awesome, awesome. My mom is 83. She had radiation for breast cancer 4 years ago. She has been on tamoxifen for the past couple of years. She has been chronically dizzy daily for almost a year now. She's been to all the specialists and has had all the tests. No one can figure out what's causing her dizziness. Do you have any ideas or suggestions that may help her? Boy, I mean, I would assume that they've already looked at all of this, but is it orthostatic hypotension? Is she struggling when she stands up? Is it low blood pressure? When we see older women, a lot of times we will see them struggling with their blood pressure. So I assume they obviously checked on that right away. So it's kind of hard. Everything that I think of off the top of my head, I'm sure it's going to be stuff they've already tested, because it sounds like it's something not common. You know what I mean? It sounds like it's something that I'd have to like really sit and ruminate on for a while before something new could hit me. I'm going to be coming up with all the typical stuff that I'm sure they've already tested for. I bought it on Amazon. Okay. Pea protein. I get my pea protein from Designs for Health because I love them. But I'm sure that they have good ones on Amazon too. I'm not sure. I want a new one. It was not fun last time placing it. Yeah, I hear you. Best suggestions when I have to have it removed. I normally have, oh, I'm so sorry to hear that, Misty. I absolutely understand. Let me tell you, it took them an hour to get mine out. Okay. I hear you. Okay. So definitely take ibuprofen, and I would talk to your doctor ahead of time and tell them, listen, this was incredibly painful for me. I need pain medication. All right. Because it is becoming more common that they are offering women true pain medications for these procedures, because these are procedures and they're incredibly painful. I mean, it's wild how painful this is. And, a lot of women go in totally unprepared and are told like, oh, this is nothing. And it's not nothing. It's very painful. I am right there with you. So talk to your doctor, see if you can get some real pain medication for that procedure. Okay. It will help. My Marina. Yeah, that's what I had too. Look into the dizzycook.com. I have vestibular migraine, and she's okay. Perfect. Yes. Thank you, Jennifer. Love it. Good to see you, Jennifer. All my friends are here, you guys. All right. Well, it looks like that is the end of the questions. So let me stop the recording here.